Hi, I'm Terry with Memory Treatment Advisors. I help families move from panic to plan when facing Alzheimer's and other causes of memory change. Today's episode is all about a question many families quietly ask after a diagnosis. What happens if we do nothing? And it's a fair question, and the answer may surprise you. An Alzheimer's diagnosis comes with overwhelming lists of options. Medications, scans, lifestyle changes, and even clinical trials. But not everybody feels ready to jump in immediately. Some hesitate for very good reasons. A lot of people fear the side effects from the new medications like Leqembi or Kisunla. A lot of people still have cost concerns, even if your insurance pays for it. Most insurance companies only pay for 80%, leaving 20% for you to cover. That's in addition to any travel that you might experience or time off of work that you might need. The time and travel burden for infusion therapies and follow ups is significant. Um, One of the things that you're also going to have to deal with is seems like there's always somebody in every family who believes that nothing will work anyways. And that goes for any disease. So that's something to think about. Sometimes families simply want to focus on comfort and quality of life. And that's completely understandable. Another and very challenging example of a situation where a caregiver might not want to treat is when the person you're caring for is also your abuser. So we'll address these as we go through this. All of these reasons are valid, but it's important to understand the trade offs that you make in choosing not to treat. Alzheimer does not pause when left untreated. The disease will continue to progress. And I'm going to say that again because it's very hard to hear. It's even harder to absorb that fact. Alzheimer's disease will not pause. It will continue to progress as you're making the decision on how you're going to move forward. It will continue to progress if you choose to do nothing. If you choose not to treat, the symptoms will seem to worsen faster without intervention. If you delay treatment, even for a few months, you may miss that very tiny window when early treatments work best. I've seen that happen a number of times, and it's devastating. Remember, Leqembi and Kisunla provide the most beneficial results when you or your loved one are in the very earliest of stages. It also limits the amount of time you have for planning, both legally and financially. That window will also shrink very quickly. Remember, insurance companies do not want to provide life insurance or long-term care insurance to people with chronic diseases. So once you receive that diagnosis, you have a very short window to make those purchases because once the claim is filed with your insurance company, your medical insurance company, all of the other insurance companies are going to know very quickly. So, an example that I'd like to provide is a gentleman that I met at a convention or at a conference. His name is Sam, and he was diagnosed with mild cognitive impairment due to Alzheimer's. His doctor did encourage him to begin Leqembi, but he was really hesitant about the infusions because I mean, it sounds silly, but he doesn't like needles. Not many people like needles, especially big needles. And he was really nervous and scared about the possible side effects. So He and his wife decided to take a year and to think about it. Well, within that year's period of time, Sam's symptoms had progressed beyond mild and into the moderate stage. And by then, he didn't qualify for the treatment. And, as he kind of meandered away, his wife just commented and said they wish they had tried something. They wish that there was something they could do, but they were at the point where they couldn't do anything anymore. One big reminder, one important reminder as we discuss this is current FDA approved medications do not cure Alzheimer's. They do slow the progression when you catch it in the early stages, but they are not a cure for Alzheimer's disease. Starting early can possibly mean more time and even years of independence. We don't know how many years of independence it could provide. In some people, it's only months. Um, but in my family, in what we've seen, that's provided little more than 5 years of independence for my mom. And she very easily, if she had not gotten married this last weekend and moved in with her brand new husband, um, she would still be living independently. And I don't see that changing. She loved her independent living program. And yeah, we just don't know how many years of independence it would give you. This also means that you would be able to drive your car by yourself longer. You and your family could enjoy more trips and vacations. You would enjoy more holidays with your family. You would continue to manage your own finances. For people that are diagnosed younger rather than somebody in their 80s, it allows you to keep your job. It allows you to keep your benefits. That's big. And maybe even meet some new grandchildren along the way. Delaying treatment does not mean you have no options. If you decide to delay or to not treat, it gives you a chance to focus on brain healthy habits like adopting the mind diet, increasing your nutritional intake with pharmaceutical supplementation. And when I say pharmaceutical supplementation, I mean uh, solutions that come from companies like Metagenics and Pure Encapsulations. Those are premium supplementation solutions. It also still gives you a chance to increase your exercise. Enjoy brain stimulating games and crafts. It allows you to continue to, or you're encouraged to continue to foster your relationship with a higher power. Meditation has helped a lot of people. We also encourage you to stay connected with the people that you love the most and increase your social engagement. If you choose not to treat Alzheimer's or your memory loss, it does give you a chance to treat other health issues and impact brain function that way. Doing a better job of managing your diabetes, your heart health, your sleep apnea, or depression will go a long way to foster brain health. You still want to monitor your symptoms regularly with a memory specialist, a neurologist that specializes in memory care, or even a memory care clinic. Also, I encourage you to keep your legal and financial plans updated, but share those plans with someone you trust. You need to make sure that somebody knows what you're working on there so those choices can continue to be honored. If you're choosing not to treat because the person you're responsible for, that you're caring for, is also your abuser, You owe them nothing. You owe them absolutely nothing. And you do not owe an explanation of your decision to anyone else. You are well within your rights to walk away at any moment. Walk away and let the state take care of them. You are not responsible to take care of your abuser. So, not too long ago, I read about a lady named Maria. She was still really young. She was only 66. And because of some health related issues, she decided that Kisunla was not the option for her. So instead, she focused on controlling her diabetes. She changed her diet. She joined a walking group. She became much more active with a social group at church. She also stayed active with a group of ladies that she had known for many years. And she even started dating again. She participated in cognitive training. And because of that, her symptoms did continue to progress, but at a much slower rate. And her neurologist does continue to monitor. One of the things that was quoted in the book was that she said, "It's about staying engaged and active. I'm still making memories." That was the direct quote. So if you are someone who, or if someone that you know, decides not to treat memory loss with Leqembi or Kisunla or some of the newer products or the newer treatments that are getting ready to come out, I would strongly encourage you to look into Dr. Dale Bredesen's protocols. Um, you still have to make some significant changes in your life, but his patients are thriving despite experiencing memory loss. He has a number of books that are available on Amazon. Just search for Dr. Dale Bredesen and you'll find his books or his website. If you Google that, you'll find his website, Apollo Health. He has a couple of different solutions. There's a pre-code protocol, and for people that are starting to develop symptoms of Alzheimer's or have Alzheimer's, his protocol is called RECODE. So preventative solutions are pre-code. Those who have Alzheimer's or are experiencing memory loss would look at the RECODE product or that solution. I follow his RECODE protocol like my life depends on it. RECODE is very, well, it's more aggressive than pre-code. And because my grandmother had Alzheimer's and because my mom has it now, and I have a similar genetic profile, also, I'm on the cusp of turning 60. I fight Alzheimer's disease every day, and Recode helps me do that. If at some point I do become eligible to take part in a clinical trial, either to prevent Alzheimer's disease or to treat Alzheimer's disease, I, like my mother, will be first in line to get that infusion and to begin that treatment. It is something that I feel very strongly about. However, I honor and respect other people's choice not to treat. If someone you love is facing this decision, ask yourself, and if they'll let you participate in that decision with them, ask them, what are your goals for quality of life? Are you even eligible for treatments that slow the progression? Um, Another good question to ask is, how do you feel about the potential side effects and the risk that are involved? Can you handle the monitoring requirements? For the first 18 months on Leqembi, you have to go in for an infusion every 2 weeks. With Kisunla, you only go in once a month, but that's still a lot. Also, ask how that decision will affect your family and the partner that's helping to care for you. Also, I want you to think of it this way. What would you do differently if you or someone you love received a cancer diagnosis? Would you rush into surgery? Would you try to get chemo or radiation for them as quickly as possible? If those treatment solutions were not options for you, would you spend days online searching for alternative treatments? Would you search for treatments outside of the US? I think for the vast majority of us, the answer to that question is yes. With a cancer diagnosis, I'm going to pull out all the stops and make sure that I get it treated as soon as humanly possible. And if that's the case, why wouldn't you do that with an Alzheimer's diagnosis? This is a treatable solution now. This is a treatable disease now. So, in closing, you do not have to treat Alzheimer's disease, but doing nothing does come with consequences. No decision is also a decision. You or your loved one will experience faster progression. You'll have fewer options and less planning time. And that's okay if that's the path you choose. What's important is making an informed decision while you still can. These are hard decisions for any person or any family to make. And if you need help weighing those options, I'd be happy to help. Go onto my website and book a free clarity call. Together, we'll talk about the decisions that you need to make, and we'll get through that. So go to my website at memorytreatmentadvisors.com, go to the scheduling button at the top, click it, and schedule the free call. Thank you for taking the time to join me today on Surviving Alzheimer's: Clarity, Courage, and Care. Until next time, remember, you're not alone in this journey.